Welcome to Project Update. Today our guest is Kevin Guthrie. He is the Public Safety Emergency Manager. And Kevin, you've been doing a lot of training lately. A lot of things going on. Tell us a little bit about it, and
Sure.
we'll go to a demonstration.
Very good. We're within the emergency services, the countywide emergency services, which includes all of our law enforcement, firefighters, paramedics from all agencies, all 5 municipalities. We've done a holistic approach to training with regards to infectious disease. Now, it's not to say that we haven't ever done infectious disease training, because infectious disease at its heart is a hazardous material. So we do hazardous material training, public protective or personal protective equipment training all the time. We do it at least annually within the fire departments. Also, we do that as an ongoing, I say we, the Flagler County Sheriff's Office and the law enforcement agencies do that as an ongoing annual training as well. But what we've done this time is, with the hype of Ebola, with those things that are going on, we thought that it was a good time to help calm the fears of our responders, as well as reassure them that we have the equipment and the resources available to do that. So what we've done is over the last 3 or so weeks, we've been in overdrive, if you will, on conducting personal protective equipment training, specifically at the level C level, which there's several different levels of personal protective equipment that goes above just your gloves and your mask. And there's 3 levels, and there's level C, which is the next lowest category, all the way up to level A, which is the highest, which is, people have seen on TV, and that's a self-encapsulating breathings, SCBA tanks.
Kind of thing,
Exactly, space suits. But what we've been doing is focusing on that Class C level, because that's what's used for infectious disease. And we've been doing that. We've trained well over 300 people in the last 3 weeks.
And we had a very successful media demonstration, and let's go to that, and people can see how the training worked out.
All right, I'm going to go ahead and invite the public safety agency heads that are here, Dr. McCabe, to come up and join behind me, if you will. And then we're going to get started. Maybe it'll just be Dr. McCabe and myself. Everybody else is kind of camera shy today. Okay. All right, good afternoon, thank you for coming. My name is Kevin Guthrie. I'm the Public Safety Emergency Manager for Flagler County. And I want to welcome you today to our media event regarding the infectious disease training that we have been doing here in Flagler County with all of our municipalities, our private hospital, Florida Hospital Flagler, and our health department here that is local. On behalf of Patrick Johnson, the Public Health Director here for Flagler County, and Dr. McCabe will be speaking on behalf of Florida Hospital Flagler. I want to, again, thank you for being here. In the late, or actually the mid portions of October, we came together, Florida Hospital Flagler, Department of Health, and Flagler County Emergency Management came together and made a decision based on the Ebola situation that was going on, but more holistically, the infectious disease control measures that we have in place and have had in place for Flagler County for quite some time. We thought it was a good time to look at our coffers of equipment, to see what we had, and get ready to do some refresher training within the county. We also made a decision at that point in time to put together what is referred to as an incident management team. I think one of the successes that we've had so far is that we did do an incident management team to respond to this issue of infectious disease. And what we did is it wasn't just an emergency management incident management team, but it was a multi-jurisdiction, multi-agency, including private sector incident management team. Represented in what we would refer to as Unified Command is Robert Davis, Chief Nursing Officer at Florida Hospital Flagler, Patrick Johnson, the Health Department Director here for Flagler County, and then myself as the Emergency Management Director. Beyond that, we selected an Operations Section Chief. The 3 of us selected Operations Section Chief, which is rotating between Flagler County Fire Rescue. The current Operations Chief is Lenny Enslaco. Our next operational period, or I'm sorry, 2 operational periods from now, we will revert back to our previous Operations Section Chief, which is Deputy Chief Jerry Forte. From there, we also established some folks to assist us with logistics, some folks within emergency management, Flagler County to assist in the planning role. So we are thoroughly prepared to respond to any type of infectious disease. But what I really want to focus on here today, besides the incident management team, is the actual rollout of the training, the refresher training that we've done for our first responders. And today what we're going to have for you is a demonstration of that training led by Chief Insulaco. But again, I think important to point out here today is these are protective measures that we have had in place for a long time, and this is nothing that we just created over the last 6 or 7 weeks. This is something that we have refined, retrained, maybe dusted off the cobwebs a little bit, but we do protective measures, universal precaution protective measures here with our first responders all the time. We train that all the time, and this is just what we could do a little bit better to prepare ourselves for this incident. So with that, Dr. McCabe, you have anything you want to say in an opening statement, or do you want to just go straight to questions?
I can say a
All
little
right.
I just want to applaud Kevin for all the work that he has done, as I call it, herding the cats, but really getting people across multiple agencies to collaborate. Oftentimes it's difficult to accomplish that. He's done a tremendous job, and I think everyone in Flagler County, City of Palm Coast, City of Flagler Beach, and the hospital as well, we have really come together to bring the best that every agency has to offer in terms of ideas, and it's been a tremendous effort on everyone's part. Again, many of these things were in place prior to the Ebola threat. However, this has been a wonderful opportunity for us, again, to revisit the protective measures that we have in place for our community, update some of those policies, make sure that everyone has the proper training and equipment to do their job.
Again, I'll just reiterate what Dr. McCabe said. As far as the agencies that are represented here today, we do have the City of Flagler Beach Fire Department and Police Department. We have the Flagler County Sheriff's Office. We have Palm Coast Fire Department. We have Bunnell Fire Department. We have Flagler County Fire Rescue. I believe, looking around, I do not see anybody from Bunnell Police Department, but Chief Tom Foster has been very much involved in that. Our communications section of our Flagler County Sheriff's Office and Dispatch has been very involved in that. And I'm sure that I'm going to miss one of the first response agencies, and that's why I usually don't do that, but I wanted to anyway. And then, of course, our Florida hospital staff has been involved, especially Dr. McCabe, being our medical director for our fire rescue departments, has been intimately involved since the very beginning of this. So with that, we'll take any questions, and if anybody has any, and if they do not, then we'll get straight to Chief Insulaco with a demonstration of our training. Any questions? Well, what we want to do first and foremost is we want to advise our community that we're prepared. We've always been prepared. It's just that at this point we've taken the necessary precautions to ensure that we have a unit that can transport folks, as well as make sure that the equipment that we've had stored in the warehouses and the stuff that's been stored on the trucks is in usable shape and it can be used, that it can be deployed at a moment's notice. I think when it comes to the hype, specifically that, is we're not playing into the hype. We're just informing our community residents that we are prepared. There has been questions. Are you prepared at the local level, or are you prepared at the state level? I can't speak to the state, I can't speak to the CDC, but I can assure the residents of Flagler County that we are prepared at the local level. I'm going to let Chief Insulaco, as he does his demonstration, talk a little bit more about the rescue unit, but in an executive overview, we have taken a spare rescue unit that we had available at our warehouse, our vehicle storage building, and we have outfitted this particular unit that can respond 24 hours a day, 7 days a week to any type of infectious disease situation. We're going to have to work, when we're presented with that case, it will be a unified incident command decision. It will not be a decision made in a vacuum. It will be in concert with the Sheriff's Office. It'll be in concert with the CDC. It'll be in concert with the State Department of Health. But at this point, I'm not going to get into the legality side of the house. We're prepared for it. We believe that our professionals, our medical health professionals, are ready for any type of incident, and I'm sure that I have the utmost faith and confidence that they will be able to get a person to the proper medical attention when that time comes. Anyone else? All right, with that, I'm going to do a definite cutoff here, and I'm going to allow the cameras to reposition themselves, get themselves set up. I'm going to let Chief Insalaka go get his folks set up to start doing a demonstration of the infectious disease protocol, if you will, how we're going to dress out, what we refer to as donning and doffing of equipment. So I'll let him get set up for that. Give us about 2 minutes, and we'll be ready to go. All right?
All right, what we're going to show here is suiting. Putting on it's actually a chemical protective suit. It's going to protect the wearer, which is going to be your first responder in this case, whether it's law enforcement, police, ambulance, fire rescue personnel. We may all be there at once or at separate times. Doesn't matter who's first. We're all first responders. We're going to go ahead and put them in the gear. When we do have a call that we're highly suspect of having a highly contagious or infectious patient, putting the suit on is the easiest part. The tricky part is once it's contaminated, doffing the suit is what we call taking the suit off. Right now they're donning the suit. 2 or 3 rescuers will help a wearer get dressed. Actually, they'll help 2 wearers. We're going to call them entrants. We're preparing 2 rescuers, paramedic, EMTs, firefighters, to go in and make the entry and make the contact with the infected patient. Notice the suit is plenty big. You want the suit plenty big. You do not want it to tear when bending over, kneeling down, or carrying equipment. Again, the suits are made for 100% chlorine and ammonia type atmospheres, so something as fragile as Ebola is a lot better to handle for us in the chemical suits, because the chemical suits actually overprotect you for what you're wearing. If you've watched some of the film on TV, on news media nationally, you've seen even paper suits, aprons worn. That's what they're actually wearing in Africa. For us to do that, we're used to wearing these suits in a chemical atmosphere. We have them readily handy, so we didn't have to order them. It's something we plan for all the time, so use what we have. And the way they're going to dress is in a level C suit. That's level C splash protection. Ebola, we all know at this point, is transmitted by liquid contact or direct contact. If you totally protect the skin in any liquid that's in the eyes or in any perspiration you as the rescuer or patient might be having, you're going to be well protected. Remember, these Ebola patients, it's only when they're very sick and showing very severe signs that their organs start shutting down, and that's the dangerous point, to when most of their body and body fluids are contaminated. The early stage doesn't worry us too much, but we're still going to take the precautions, because what we're trying to prevent here is getting the patient proper care, getting them to a proper facility, which is a hospital, for definitive care, and then, of course, making sure our rescuers can go home to their families the next day and do not have to spend 21 days in quarantine. They have put on new 2 inner layers of gloves, because that's going to be the most contaminated part. The inner layers will probably never see any contaminant, which are nothing more than regular inner medical gloves. The outer gloves, just make sure that they take the full flexation of the suit so that we can pull that glove out of there. I told you before, putting the suit on is less than half the battle. Where you can run into most of your problems once the suit's contaminated, taking it off. That suit is yellow, just like a banana. The way I taught our 300 rescuers, I believe, over the last week or so, week to 10 days, is that like a banana, you don't eat the yellow part. You eat the white on the inside. That's the safe part. That's the part that tastes good. When we peel this suit back, we are literally going to peel it back to where you see the white inside. And that, of course, is going to take place at the hospital after we've dropped the patient off and then go through what we call a hazard reduction zone, decontamination. Decon is short for decontamination. The one way to decontaminate and isolate Ebola or any infectious disease is usually a 10% bleach solution. With that in mind, at the street level, we're going to use a 12 to 15% bleach solution. We've got the bleach solution there in the bucket. We're using tape to seal up any possible skin contact as the rescuer goes to stretch, maybe move with equipment. They're going to have to make sure they have enough room in the suit. It's plenty big, but yet they're able to move around. They're able to grab tools, equipment. I can tell you this, since doing the training, the anxiety level amongst our rescuers has gone down tremendously, where they were worried about doing it because maybe we hadn't trained in the suits in over a year, and we do go through this training every year. Now that it's fresh in their mind, they got to see it, and they got to see it specified for Ebola or highly infectious contagious diseases. They were, the anxiety level, instead of worrying about what they're doing, they can concentrate, use logic, use common sense, and rely on their training. At this point, you're all ready to go in, correct? All right, you feel good, you can bend over, touch, do whatever you want. They'll go in, make contact with the patient. Only one of the rescuers will. The other rescuer will be at the entrant. Why? Why get more people contaminated and actually up close and personal with the patient? The patient only needs one caregiver. The other person is in there just because we do everything in the buddy system in everything we do. We'll call it the backup plan. If he was to tear his suit, have an issue, he could come out, go through decon right there on the scene. The second entrant can go take his place, and we'll dress out more people outside in chemical suits. Most rescuers and trucks have been outfitted with chemical suits and extra chemical suits because we may have people on scene that we need to dress. All right, he would go get the patient, of course, to carry him if we have the stretcher in here, a backboard, and all the plastic visqueen. The ambulance is protected. At this point, we would get the patient into the ambulance, get them to where they're actually going to get help at the hospital. Definitive care is always taken at the hospital. So we do what we do best, get them there as quick as we can. They will actually go in and drop the patient off in dedicated rooms at the hospital. We've worked this out with all the hospital personnel. They have certain rooms dedicated for this. We'll drop the patient off, turn the patient over to hospital care, just as we normally would. Then, of course, we'd go back outside. Anybody contaminated would get back into the possibly contaminated unit, right over to an area that we've worked out with the facilities manager at FHF or whatever hospital we're at, and decontaminate our unit. I already told you what's the best solution to decontaminate any infectious product? The 10% bleach. Go ahead and we'll show them decon. Go ahead and just step into the suit. Step into the garbage bag with the suit. Now, what do you think is the most contaminated parts on this suit? Hands, and then where he might have walked in some contaminant that might have been in the house. These are very sick people, usually very sick people, have spills and messes in the house that we need to walk through. So the bottom of the boots and the gloves are going to be the most contaminated part. We'll go ahead and spray them down. This is simulated bleach right here. It's plain water, so if you get it on your clothes, you don't have to worry about it. For training purposes, go ahead and rotate the hands. Okay, now we'll do the backs of the feet. Notice the person doing the decontaminating, they would be in a suit, just like the entrant. Okay, no differences in levels. Once the bleach is on there for 4 minutes, CDC and all of our training and expertise that we've relied on throughout the past couple months tells us that 4-minute time is the time frame it takes for bleach to actually kill the active infection. So we'll let that sit for minutes. We'll actually spray them down from head to toe, letting what drips drip into the bag. That is not the only bag that is going to be containing the suit once we de-suit or doff the suit. It'll actually be triple bagged and hauled off by a special contractor, not with normal hospital waste. You can ask him to lift up his arms so you can get under the armpit area, even spread his legs a little bit. And at this point, 4 minutes, let's say I anticipate this taking 10 to 12 minutes. We're not in a hurry with this. This is something you want to take your time with. Now, most of the contaminant, very little is on the floor, which it'll be outside, and then it is just residue with bleach in it. There should be no damage or harm to anything infectious right here to spread the product. Next, if you left him a tab around the face piece, he can start undoing his own tape, throwing it in the bag. Notice he's not in a hurry. We're taking our time. We're being methodical. This is nothing new we've done. We used to do this years ago with anthrax. Same type of thing. That was a biological agent, 10% bleach solution, same suits. Worked for us in South Florida. I know in 1 month we had 300 anthrax response calls on the hazmat team I was on. No contamination ever came of anybody dealing with any of those. Most bigger cities have a hazardous response team that specializes in this. We do not in this county, but with the resources we have, we can do just as good a job right now with this situation and give our responders the best protection as well as the patient, getting them to where they need help. All right, next we'll go ahead and start peeling his suit down from top to bottom. This would be a suited up, these two rescuers right here would be suited up in suits, and we just start peeling down the white. You can unzip it. Now there's no danger to these other suited personnel right here because the bleach has already done 99% of our job. The rest is just precautionary. You can just pull it down. That was good. Notice the black gloves come right off. They're now part of that suit, and they are now inside out. He is left with the inner glove. He will not touch or help out with a thing so that those, the bluish color gloves do not get contaminated with anything at all. We put booties over his regular feet so that his socks do not get contaminated. He will move off to another area. You still got that. Next, what he will do is kick off the booties one at a time. He has 2 sets of gloves on now, inner gloves, which should have no wetness on them whatsoever. You can actually go ahead and take one of those off just as a precaution. Throw them right in the bag, or this bag, doesn't matter. And then there's going to be a 10% or more bleach solution in this 5-gallon bucket. He's going to take his mask off, leaning over so any drippings go down into the bleach solution in the bucket. Just sticks it right in there. And he pulls his gloves off. And he just walks away to safety. You should have nothing wet on you whatsoever other than the perspiration you so graciously offered. Any questions at this point on what we did, why we did it? Go ahead.
Prep work, put the suit on, is at the firehouse. Where is it? Right outside.
Well, where we did the training, it was at all the fire stations within the county. Where are we going to? The suits are already on all the frontline trucks. All 7 rescues. I think there's like 15 fire engines in the county. They've all been outfitted with suits. Everything you've seen Joey here wearing, who was the gentleman in the suit, we've got that on all trucks to all personnel. The only ones who aren't carrying suits are the sheriff deputies. We carry extra suits on all those units, not just for the personnel of that unit. Palm Coast fire engines carry 5 suits. My rescues are carrying 2 extra suits. So there'll be plenty of extra suits on scene.
And please go over again the number of personnel that goes into a house. Say, for instance, 370-pound man.
It'll be two. In that case, it would be two. And in that situation, they may bring the stretcher in. Every situation, the weight of the patient, the level of contamination, other occupants that might be contaminated inside are going to dictate what we're going to do tactically and safety-wise on the scene. Any other questions?
And if two go in, you also have
We have two. We always have decon set up outside, even at the residence or business, wherever this call may take place. We'll always have two dressed outside. That's twofold. In case there's a tear in a suit, they can always come out. That whoever suffered the tear in a suit can come out and begin getting treatments of bleach washed down and desuited right away. One of the decon patients will start gearing up another one outside and let them go in and still maintain 2 in, 2 out.
So what we just saw, suiting up and suiting out,
Mm-hmm.
would happen just outside the building or house.
Yeah, and it would be times 4. You'd see 4 people suiting up and maybe 8 people dressing them. And that's what you'd need all the responders for. There'll be plenty for everybody to do, trust me. And there'll be supervisors. One other thing the hospitals around the United States and CDC noted with the first case in Dallas or Texas was there needed to be a supervisor. Just someone standing back. You might have seen me catch a couple nuances or things that they were doing that I wanted to make sure they got done right. Even when I taught this, if I was busy teaching it, I would miss a couple things. One time I forgot to put the garbage bag down when I was teaching it. A guy that saw me do it the day before said, "Hey, you got to put the garbage bag down." So there's something to be said for somebody just standing back supervising because they can catch even a very thorough professional's errors.
So I hope everyone can appreciate that the purpose of all of our efforts over the last 2 months of time and the many, many hours that have been spent by representatives of multiple agencies has been to provide the highest level of safety for the residents of Flagler County. And this is true not just for Ebola, which happens to be the threat of the day or the threat of the month, but for things like enterovirus, for things like influenza. Previously we've had scares with anthrax. There is no shortage of biological warfare or biological contaminants that could potentially threaten our community. And again, rather than playing into the hype, I think what this has done is reassure all of our first responders and all of our healthcare providers in our community that we have the skills, we have the equipment and the resources to take good care of all of the members of our community.
And then from an emergency management point, I'll just say that anytime, if something like this happens inside of Flagler County and its 5 municipalities, we will be on standby ready with emergency management, including our incident management team, to respond to that incident and any size or complexity that we need to when that time happens. So any other final questions of anyone? I know a couple of people wanted me to talk to me offline, so we'll get that done right after this. But with that, I conclude this media event, and I appreciate you guys coming out. Thank you very much.